Adolescents and young people represent the future. For many, this period of their life is a time of discovery, change, and hope. It also marks the beginning of puberty, and for many, their first sexual relationship. A safe transition to adulthood requires knowledge and skills about sexuality, health, and rights. In East and Southern Africa, there are 158 million young people aged between 10 and 24, a third of the total population, and this number will continue to grow. All young people have the right to education about their health. This should be relevant to their lives, help them prepare for puberty, and protect them from HIV and unintended pregnancy. This is a region where 50 young people are newly infected with HIV every hour. But still, less than 40% of young people have adequate HIV prevention knowledge. Young women are more affected by HIV than men their age. They are twice as likely to become infected. Comprehensive sexuality education has the power to change this situation. It needs to include essential topics such as puberty, relationships, decision-making skills, HIV and pregnancy prevention, gender equality and gender-based violence, and sexual and reproductive health and rights. But only 30% of these topics are included in the curricula in this region, and even fewer are being taught in classrooms. This means that young people are not being properly prepared to deal with important issues in their lives. The average age for first sex in the region is 17 years old. Sexuality education does not encourage early sex. In fact, it can help to delay it. But education alone is not enough. It needs to be delivered together with sexual and reproductive health services that are tailored for young people's needs. The health services young people need include contraceptives and condoms, voluntary male medical circumcision, pre- and postnatal care, safe abortion where legal, HIV testing, HIV and STI treatment and care, and the prevention of mother-to-child transmission. At the moment, access to these services is severely limited, and there are legal, cultural, and cost barriers for young people. Early and unintended pregnancy is a reality for many young women. Only 1 out of 2 women in the region has access to modern contraception. In some countries, 1 in 5 young women has started having children by the age of 17. Maternal mortality is among the leading causes of death for young women. For those who want to end a pregnancy, safe and legal options are scarcely available. There are an estimated 2.5 million unsafe abortions per year in this region. Young people have the right to health and should have access to the services they need, regardless of their age, marital, or legal status. Condoms are one critical part of HIV prevention. Only 45% of young men and 34% of young women used a condom the last time they had sex. In some countries, the rate is as low as 4%. When it comes to HIV treatment, young people are also missing out. Only 5 countries in the region have achieved universal access to ARV treatment, and the rates of access for children under 18 are much lower. But all of this is set to change. In December 2013, the Ministers of Health and Education from 20 countries in this region made a landmark commitment to deliver comprehensive sexuality education and sexual and reproductive health services for adolescents and young people. The commitment has clear targets that include training teachers and health workers, increasing access to youth-friendly SRH services, reducing early and unintended pregnancies, and eliminating gender-based violence. By working together to improve young people's access to good quality services and education, we can create the first generation of young people with no new HIV infections and with responsibility and control over their sexual and reproductive health, a generation of healthy and engaged global citizens. It's time to act now.